Okay. All right. So we're back. Ralph Havens, physical therapist, integrative manual therapist, and my good friend, Dr. Tom Giammatteo, and teacher, colleague of mine for many years, integrative manual therapy co-developer with the late Sharon Giammatteo. And today I want to ask him some specific questions. We have a short amount of time about injuries, chronic injuries, getting over chronic pains, runners, active people, other people that haven't been helped. And I'm going to start it off with two quick stories and then get right to what Dr. Tom thinks about this idea of how to help the people that aren't getting help with other really good systems, physical therapy, chiropractic. One story, short one, high school runner was injured for half a year, very severe hip pain, couldn't run for more than a minute, was seeing a very good physical therapist, doing lots of strengthening, stretching, resting, trying to run, but 1 minute of running and had severe hip pain. And she saw me, and I saw a thing that we tend to see at times, and it was a problem with her gut, her intestines. And so we changed one thing in her diet. We worked on her. She got looser that day, and the next week came back and had been running 10 minutes without pain. And so over the course of once a week for about 6 weeks, we worked on her gut actually and made sure her diet was correct for her. And she was back to running. And so the idea was the primary problem wasn't in the joint that was causing so much pain, it was in the gut. So I'm going to ask Dr. Tom about that. And then there's a guy that, if you're a runner, Jakob Ingebrigtsen, and, gold medalist in the 1500, gold medalist in the 5000, great runner. But he recently had a tonsillectomy, had his tonsils removed because of infections they've just been having since, as he's been a kid. So he's plagued by infections, got a tonsillectomy. He also had some very significant, as you know, if you follow him, issues with his in the courts. He had a big lawsuit. I won't go into big details about that, but stuff going on. But then he got a Achilles problem that's just chronic and not going away. And so, we're not robots, and the mental emotional anguish can affect us. The infections, things in the gut can actually affect the why somebody's not healing. So Dr. Tom, thank you. I know we're coming up with the winter school for the immune system class. And so
Yeah.
I'm just going to open it up to you, and thank you for being here. Tell us what you see from an IMT perspective and these chronic injuries that aren't going away. I know that's how they tend to find you.
Okay. So happy Chinese New Year,
Yes.
the year of the fire horse. And the energy has so much increased throughout uh, the world of chaos and disruption. So I'm asking everybody just to take a breath in first. Thank you. And then integrative manual therapy and now structural medicine would look at your case of the hip is the hip pain. If traditional physical therapy, if traditional massage therapy, if traditional let's ice it, rest it, and bandage it doesn't really work, then that's probably not the problem area. That's probably the area that's too mobile, and we call that hypermobility. And there's some place that's really stuck, and so that hip joint is taking up all the extra pressure points in the body, and we feel that can exaggerate the healing process so they're not catching up. So if you're running on a hip and you're supposed to have two of them um, um, equally doing it and one hip's getting sore, you have to ask what's the squeaky wheel trying to tell you? And if the squeak doesn't get out of the wheel with simple stuff, then you have to look at the whole kinetic chain, it's called, from the big toe on the left foot all the way through the knee, the hip, the pelvis, and back down the other side to the big toe on the right foot, and see if they're equally moving, equally gliding through that whole system. And somebody stubs their toe and they don't want to put pressure on it, it can actually hurt the other ankle in the future, type of thing. So that is one phenomenon. And another phenomenon that happens with hip pain that's more of a structural medicine problem is to say that nobody looks at the abdomen, nobody looks at the GI system. And we have two parts we have a stomach, we have a small intestine and a large intestine. And on one side, everybody's heard of the appendix that hangs out on the right side of the body. And we have a similar similar issue called the valve of Houston on the left side of the body. And in a bigger structural medicine, if the gut is leaky, maybe the legs are trying to keep it tight from leaking. So your psoas muscle, which is pretty important to give you hip flexion and extension, can go into spasm. Secondly, they do a GI problem. So you actually have to go and change their diet, like you were saying, and then everything heals along the way. So when we're working on and evaluating people to try to prevent the repair of a total hip, doctor says, well, you can get rid of the hip pain now, or you can wait a year or two when it's so bad and get to us. Those candidates, probably 8 out of 10 really successfully don't have to get the surgery for another 5 years. And we really feel that the hips and the muscles of the hips are trying to pull themselves up into the abdominal cavity. And that's making the bones grind or cause arthritis there. So
And if you
that's,
could catch them earlier than that, maybe they wouldn't have that.
yeah, we've had regeneration of hits so the cartilage grows back. But you have to ask the question, right? And then I have another story of an 78-year-old man who 9 years ago got his first total hip. And last summer, he traveled for work a lot of times and he was always on his feet. He worked in factories, he was an engineer walking around, and he was supposed to fly out, and the flight got canceled. So he was sitting in an airport for 9 hours, and then his hip started to hurt. And over the time, the hip that was non-surgical came more and more. So it was true arthritis where bone on bone grinding pain. And, uh, by the time we got him to the doctor and everything else, the pain was really critical. He was lost weight from pain and not feeling very well. And so when we put the new hip in, all his pain went away. It was perfect. But it was like, then his ankle started hurting. And I said, that, Alan, the ball and socket made by man isn't as sophisticated as the ball and socket that you got from your creator. So you actually tightened up your hip by wearing a mechanical ball and socket. And the orthopedist knows, well, if I put this hip in 7 or 8 years from now, we're going to get the other hip and do it over there because we're putting more strain on it. And
Yeah.
then got that one done, and the strain went into his ankle. So we're like whack-a-moling him back the process. So when I first met Alan 6 years ago, he had an ankle brace on because his ankle was all turned in and he couldn't have foot pain. We got him out of that, and now that he's got his new total hip in, it's being forced down to the ankle again. So we're trying to get the mechanics working again back and forth. When you do get a total joint, it's very linear. Man cannot think of the optimal movement. Your knee has lots of different plays, even though it just bends back and forth, it glides and slides and all this stuff. And when you put a piece of metal slab with a pin in it, you put those strain patterns someplace else.
Yeah. And can you talk briefly about what a great success about this idea, like if it's like a car with a problem and the little light goes on, you could just put a little tape across the light and not see it.
Right.
You could cut the wire so you don't see the wire, and it looks better for a while, but it didn't fix the problem. Is IMT is kind of like let's go find what's causing the light to go out instead
Yeah.
of the hip.
And again, if you're not getting success with your PT, your physical therapist, your acupuncturist, and your chiropractor, those are all beautiful systems. But if your problem doesn't fall in their system, then
Yeah,
that's a problem for you.
that's what I was had
Right?
written down ahead of time, like what system are we in and where's the primary problem? And then with the immune system, that one guy is great, and I haven't seen him as a client. It'd be great to see him as a client, but Jakob Ingebrigtsen, great miler, gold medalist, dealing with chronic infections for his whole life. He's only in his 20s. And then he had the surgery. And along the way, he's got this Achilles that's starting to bug him. And he missed a whole season. Um, the immune system can be the
Yeah.
primary thing too.
So we look at cultures, we look at where your family's from. Um, people, Eastern Europeans, the Baltic, the Norwegians,
He's a Norwegian. He's a
yeah.
Norwegian.
So that whole strip actually got affected back when Chernobyl was happening. And there's a radiation tendency in those muscles and joints, even from Chernobyl, that is showing up in the generations even born today. So
Wow.
I had a woman that was Polish that came over here when she was 14, and uh, she was a nurse. She had to get all her vaccinations and played by the rules. And she used to go get facial treatments, and every twice a month, the anesthetist would come in and pop a pimple in her cheek, and they'd pour out about a good wedge of pus in it and stuff like that. So last year she was walking around Lake George and she got bit by a bunch of gnats and the whole all blew up and it became septic systemic
Oh,
lupus, right? And it looked like the battle zone there. And it was just like, well, what's the straw that broke the camel's back? So her whole immune system. Over the year, we rebuilt her GI system, got rid of the leaky gut, re-educated the thymus gland and the whole immune system, so she wasn't attacking herself. And it's December was 1 year, and she went from this big, super acne face that looked like somebody really looked like it burned her face off, to this year where her skin's great, but it was all about diet and the expression of those things. And when we're younger, we have some slack in the system, and there's a proverb in Chinese medicine: for the first 35 years, you look good, but all your sins that you created show up after that on your face and everything afterwards. So you start to show as you lose your youth in that piece. And it could be regenerated if you change the oil in your system or eat better foods, but we're pretty toxic in what we have for processes. So if we get
yeah.
food,
Every little bit helps. Like,
yeah.
the diet helps.
So my mantra of a diet is no gluten or oats, no white sugar, honey and maple syrup are okay. No peanuts, no almonds, because they both have funguses on them. Both of them are pasteurized before they come into the country. And we feel that those are like the jet fuel that makes the fire go crazier and crazier.
Yeah. What would you say? Like, I get it. I'm so lucky I found it. I wish I would have found this way of thinking and working before, before my late 30s. Imagine what could have been like as a runner knowing this stuff then. But any words you would give somebody, a runner, a physical therapist, a chiropractor, massage therapist, acupuncturist, somebody that's either dealing with somebody that has pain, or they have pain, and they keep going down the road of I see so many runners and they keep trying to go down the road of we got to strengthen it, and they're doing all this stuff in the gym, and they're trying to rest it and do the right dosage of running, and they've got all these systems, but it's not really they're dealing with chronic stuff. How can
Yeah,
you?
look for somebody that has structural medicine. There are very few people that do, and understand that structure leads to function, and you have to feed the right system in. So it is a physical approach, it's a mental approach, and it's also a dietary approach into figuring out these cases. But if 2 or 3 sessions do not improve you, and by 10 sessions with any of those practitioners, you're in the wrong camp.
Yeah,
And
you should feel better when you leave,
yeah,
and that's what sold me on it. Just
right.
the function.
And so I just got certified by 2 different organizations because I really wanted to study the field. I've been an acupuncturist since 1992, and I don't consider myself a doctor of Oriental medicine or an acupuncturist, but I really appreciate the Chinese traditional medical system. And I just got certified again in dry needling because I thought it was not the best tools. And one of the things I would say, if dry needling didn't help you in 2 visits, don't go back, please, because it's really doing damage at a structural level. Yeah, numbs you up for 2 or 3 years, and you're gonna be twice as bad 3 years, 4 years from now.
Well, I thank you for this, Tom, Dr. Tom. This is it reaches me. I get it, and I'm I was dealing with two times in my life that I couldn't run, the 8 month with the calf thing and 2 years with the severe bone knee thing. And I did find my way out. It was by finding the right system and the root cause and
Yeah,
doing it. And so, like my mission is to help people, me with the runners and active people, you with the world. If you don't have your answer yet, there is a way to find why. And so I'm just reaching out to people that want to know this. Reach out to Dr. Tom, imtwellnesscenter.com, and his phone number is where is his phone? There it is. 860-561-2286 in West Hartford, Connecticut. And me on the West Coast, ralphhavens.com. And let us know if you're dealing with something, if somebody's got a problem. And my person is here for my next thing. Yeah. Yeah. So anyway, thank you, Dr. Tom. I guess I got to
all right, well, Happy New Year. This is the first one we've done, so
Oh, good.
hopefully we have a nice year of talks. Okay.
Yeah, my friend just walked by, so he gave me a 5 minute thing, so I've got a little time. So thank you so much. Reach out to you guys, and let's fix you guys up and get doing what we're here to do. I'm gonna turn this recording off.